Hello students, we'll discuss a important case which is often we see in the surgical OP and also will be kept as a case, short case in the exam. So what this condition is, look at that, see that a left submandibular region, there is large swelling in the mandibular margin. See the swelling here. See the swelling, it's a very typical location here. See this. So what is this condition is? It's the left submandibular salivary gland swelling, maybe neoplastic, maybe inflammatory, but such a large swelling, the next is important. Short duration, painful, fever, chills are there. That means probably submandibular gland, salivary gland, CLadenitis, an inflammatory thing. But such a large swelling, presenting as inflammatory thing, not that common. That is, if it is so, that is due to stone which is blocking, because salivary gland stones are more common in the submandibular salivary gland, not common in the parotid gland, because it got a mucus content and non-dependent drainage and contains more calcium. Whereas such a large swelling, more often it is a neoplastic condition. So mostly it is a neoplasm and probably malignant, that depending on the other clinical features, fixity, involvement of the bone, skin involvement, although if it is there, probably we think it is a malignant. Based on the clinical features, you will be able to express clinically whether it is malignant, benign, inflammatory, all those things. So proper examination is very important. So what are the features to look for? All these things I already told. Anatomical location, relation to mandible. So mandible thickening, adhesion to the mobile. If you check the mobility in two directions, if it is adherent to the mandible, probably it is fixed to the mandible, then probably it is malignant. Bidigital palpation, one from inside into the floor of the mouth, another from the outside. If this is bidigitally palpable, that means it is salivary gland, because submandibular salivary gland has got a deep component and superficial component across mylohyoid muscle, whereas submandibular lymph node is only outside, not intraorally, outside the mylohyoid muscle. So you won't be able to palpate bidigitally if it is submandibular lymph node. If it's submandibular salivary gland enlargement, you'll be able to palpate bidigitally. There is a concept. So all these things you have to look for hypoglossal nerve, because it comes very close to that. Systemic examination also important. Opposite side is important. Neck lymph node examination is important. If this is the malignancy, it can spread to the neck lymph nodes also. So all these things, examination is very important. Oral cavity examination is also equally important. Don't forget to examine oral cavity. It's a basic principle. If there's a neck swelling, examine oral cavity. If there's a oral lesion, examine neck nodes. Mutualities, always remember, that's the concept. So second is in the neck, there's the different, or lymphoma or the DDs. Pleomorphic adenoma is the commonest salivary gland tumor. Mucoepidermal, benign salivary gland tumor, otherwise also. Mucoepidermal tumor is the commonest malignant tumor. So need to do CT chest, FNEC, MRI investigations. And so that's about the submandibular salivary gland neoplasms or conditions. So inflammatory, stone, and neoplasm. These both are important. So please go through this in my manual or any other book and answer this MCQ. Warthin's tumor is pleomorphic adenoma parotid, monomorphic adenoma parotid, adenolymphoma parotid, carcinoma parotid. So student, put your answer in the comment box. Tomorrow we'll get the answer. So go through my clinical methods in surgery, manual of surgery, for details about everything, operative surgery and tissue approximation, and degenerate videos through JP publishers. Everything is there in detail. So consider all these things. So you can go through this. We'll have the entire knowledge about surgery as such, whatever required for CBME, knowledge, academic, everything. So thanks students. Thank you very much. I hope you understood this lecture very well.